Achievement, a Dungeon Crawler Carl book club podcast.
I'm JB.
And I'm Ellie. In this podcast, we are reading, researching, and recapping the Dungeon Crawler Carl series. This is a spoiler light podcast, so obviously heavy spoilers for the book we're on, but we'll try not to spoil any future events in the series so you can crawl along with us. Today is actually a very special episode, a deep dive into Team Meadowlark. We'll be looking at Amani, Ellie McGibbons, Chris, Brandon, Yolanda, and the rest of the crew. For now, we'll be focusing on books 1 through 3. If anything interesting happens with these characters later on in the series, we may come back and revisit them down the road.
For today, we have a special guest who has some unique insight into the characters we see on Team Meadowlark. Please welcome registered nurse Chad. Chad, could you please introduce yourself and tell us a little bit about how you got interested in Dungeon Crawler Carl?
I'd be happy to, JB. So I'm Chad. Like I said, I'm a registered nurse. I'm currently working in med surg nursing, for anyone who knows what that means. I've been a nurse for a little over 8 years. I've worked in oncology, psychiatric nursing, geriatric nursing. Prior to becoming a nurse, I got my master's in clinical psychology. I was briefly a professor for like a semester and a half. I got into Dungeon Crawler Carl when my wife, who's an author, saw it recommended in one of her like author book groups. And she thought I would like it, and she was right because it's taken over my life.
See, sometimes wives know the
Yeah,
right
I mean
things to
she
do.
she does.
Mm-hmm.
Yeah, yeah, yeah.
Mm-hmm. Mm-hmm. So throughout your career, I mean, since we're talking about survival in the dungeon, have you seen any like weird patient survival stories that kind of stick out in your memory?
Yeah, I so especially working in oncology was where that was the first like 5 years of the eight. Most of that was oncology. And anyone who's had to deal with cancer knows that that can do pretty much anything to you. It's pretty much the worst thing in the world. So I saw a lot of patients who went to the brink of death, some who didn't make it, but some of them who came back. And lots of them had tons of life experience and stories to share, all while they were struggling through like the worst thing imaginable. The one that I put in the notes is that I had a patient. He had tumors throughout his abdomen, and eventually it literally split him open. I had to care for a wound all up and down his stomach and chest. And then like a year later, he was up walking around. He was still back to doing landscaping.
Oh,
Like
fuck off.
I know, like it's crazy. So you get like I literally saw this man's viscera because I was changing his like tumor wound, and then like they were actually talking about hospice for this guy. Like they were gonna put him on,
Yeah.
and his wife was like, "No, he can do this." And I'm not just saying that because I'm his wife. Like he can, and she was right. And all the doctors and us, we were all so happy that she was because like it just looked really bad. And he worked like that was after he had been working part-time and then full or almost full-time for like months during his treatment too. So like this guy was tough, but it's so I think about that a lot because that was kind of the stark reality of like, how is this guy alive?
Tumor Wound is
Oh,
my favorite black metal band from the late 90s, by the way. Moving on. That is hardcore.
that is hardcore.
Like, ooh.
Yeah, that's one of the ones I can tell you on a podcast if I'm being honest.
Oh,
I had to narrow the field a little bit.
Thank you for sparing us. We appreciate
Yeah,
it.
yeah.
So, just knowing that this is your job and the seriousness, that you encounter, I had to ask, what was your immediate reaction to encountering Team Meadowlark in a fictional book like this?
I was thinking immediately like at least some of these guys better fucking make it, Matt, or I'm gonna find you. I was immediately attached. Like the moment I found out they were from a care facility and that Yolanda was a CNA and Amani was a nurse, I um I was like, these guys are it. The My heart made the same decision Carl did. Um, pretty immediately. So I was really immediately attached. I could also relate because, of course, Ellie pretty immediately started hitting on Carl, and I can relate to that because that's what old ladies are like.
I did no such thing.
You're not
Um,
there yet. You'll get there.
Ugh,
you don't necessarily know that is that is true. She is Ellie, my wife, is very, very popular in a way
hilarious.
that makes me proud. Yeah, and we can do a quick character summary for people maybe who don't remember Team Meadowlark because the major arc for most of their characters happens in book 1 and 3, I think. So if you're a little removed from these folks, we do have mentioned Brandon and Chris, who are brothers, and they were working maintenance, trying to put in some overtime, getting an oven all fixed up. Brandon, we know, is a super nice guy. He really cares about folks, because even though it wasn't in his job, we see him taking care of people in the dungeon. So we know that he cares a lot. And then we have his brother Chris, who we know doesn't say a lot, but then weirdly left the group. Since we're this is primarily in books 1 through 3 that we're talking about, he has bailed on his brother and bailed on his team, and we don't really know why. So it's interesting about him.
I lean into the idea that Chris's race selection might have just shifted his personality a bit more than people expected. Since we hear that while, Imani is side-eyeing Ellie and being like, yeah, it's body changes can change your personality. And as someone who's had some body changes, it can affect your personality.
Mm-hmm.
Mhm.
Well,
Yeah.
one thing that is pointed out is that when, like, Chris doesn't talk very much, to the point where his parents thought he was, quote unquote, I think it says a little slow in the book. Um,
Hmm. He is
and,
slow.
yeah. And so we know that when he speaks, people listen because it's important. And Chad, you pointed out to us earlier that the one of the few things he actually says in the book is what?
Uh, Jack really did have a weird dick. Yeah.
So it was critical information.
I mean, it's that we've all met people like that where it's just like they can, they don't say much, but when they do, it's like it's the thing that needed to be said, and they knew it at
Hmm.
that moment. And I really like that about Chris. I really love Chris and Brandon. I know, do we know he dies? Yeah, he dies by book 3, unfortunately.
Brandon,
Brandon
yeah.
does, right? Yeah.
Mm-hmm.
And that's such a tragedy because he's clearly just such just a good dude. He's looking
Mm-hmm.
out for his brother. He's looking out for patients. He's looking out for everybody, even when the world's torn down around him. Yeah.
And that whole thing in his message about like, just tell him I love him, and I don't care about that. I don't care about that. You can use my Matchbox cars or whatever. I'm sorry I accused you from stealing that. Like,
Yeah.
I had an
Mm-hmm.
older sibling. That's the kind of stuff that sticks with you.
Mm-hmm.
Like,
Yeah.
we've been
Absolutely. It
fighting
was.
about this for 30 years.
Yeah.
Yolanda, I think, is the first named character to die,
Yeah.
but Brandon is the first character that Carl and Donut really had any connection with that
Yeah.
that dies. I wonder if there's some type of message, or something that Matt was doing by specifically taking somebody away who was a carer and who
Hmm.
was, you know, just one of these selfless people who ended up in the dungeon. And he died basically creating a path for others, or creating a way for others to escape. So that might have been a bit of foreshadowing of the emotional ride we were going to be in for the
Yeah.
rest of the series.
Yeah, absolutely. I mean, Yolanda was, we don't get to see her for very long or very much at all. But the way they described her, I can tell you, she's a CNA, she's a tech, she's Amani's best friend. I know exactly who that woman is. I work with two of them. They are older caregivers. She's been working for a long time as a CNA. She had kids and a family, and but she did it because it was a job she was good at and she cared about it, and it made her a living. And yeah, it is honestly a shame that she didn't survive because she would have been one of the toughest people in the dungeon. Like that would have been
Uh-huh.
That lady's been through it.
Hmm. Yeah.
Yeah.
So that's Amani, Yolanda. We also mentioned him, Jack, of course. Jack, who really the only thing we know about him is he had a really weird dick and he didn't listen. They gave a simple instruction: do not pee on the wall. And
Mhm.
he peed on the wall, which could be, I mean, there could be some trauma because we don't know how many friends they all saw blowing up from the bathroom malfunction, quote unquote malfunction.
Mhm.
Oh
When,
shit.
so, part of it is
Yeah.
like maybe he's old and, he had some dementia, although, because dementia was still seemed to be affecting them
Oh,
in,
yeah. Yeah,
you know,
that's they talk about how it like fixed a lot of the stuff that's wrong with them, but like obviously, you see with like Ellie, it didn't fix hers.
mhm,
Like it didn't she's clearly still doesn't really know what's going on. She asked Carl to put on divorce court. Like she's like my Barry used to watch that. So it's very clear that that still affects them, but I mean, I can tell you I have had patients like older male patients that we had to keep telling them to put their dicks away. Like that's a
mhm,
thing. I'm sure that as to women who exist in Earth, I don't have to explain to you that there are men out there who really just like to take their dicks out and talk about it and think about it a lot. And
mhm,
when you get older and have dementia, sometimes that the wall that generally keeps you from doing that in public is just gone.
mhm.
And yep, I
Makes
mean, it did not surprise me at all. It was honestly the only shocking thing is that didn't happen sooner. Like like
I mean, it makes you
that
wonder
was
if there was a wall
yeah.
there at all stopping him from that. And
Yeah, I mean, there was probably a little bit there, but I mean, we've had patients who are like old and they will engage in behavior like that. They're saying the like dirtiest stuff, and they were like, you know, the nicest people before. I mean,
Mhm,
dementia can really change you. So we don't know what Jack was like, but in the end, he was kind of a creep. Um,
mhm.
yeah.
Yeah. I've heard that about older, old folks, like old men in particular, that because I had to write a sexual harassment training once, and it was like, how do you address the fact that just old men in, this type of care will try to grope you, or they will hit on you relentlessly, or say some fucked up shit that under no circumstance would you tolerate in a workplace, but in this particular environment, what are you going to do? You know?
Well, I'll tell you what we do. So
Hmm.
what I do is I tell all the female nurses they know that if they have a patient that is being really aggressive on them, they can call me and I'll go in there and say, "Hello, sir. We've gotten some complaints from our female staff, and I'm here to just tell you just I know you're a big fan, but we really need, just to go in there and do that because that makes them uncomfortable. That works every time.
That is
They
called
they don't see me
weaponized
coming.
homophobia.
But what
Weaponized
I'm going to tell you
homophobia.
Homophobia
also,
is the
I
fear that another larger
yeah,
man will treat you the way that you treat women.
yeah, and I'm not that big, but I am bigger than most of these old guys. Um, but yeah, but I will. The other thing I want to say is that we were going to talk about Ellie
Mhm.
McGibbons, and
Yes, we
it
are.
is not just the old men. It's
I
not,
was going to
and I think
ask.
everybody's sleeping on it. Everybody, nobody realizes how bad it is. And I think there's a good reason for it. I think a lot of these women grew up in eras when they were not even allowed to look like they thought about sex ever.
Hmm.
And
Mhm.
like, it wasn't until like very mid feminism that they like even started to have books about what female anatomy was like. And so like none of that. And so there's just definitely no room for that. And then just like with an old pervy man who just wants to take his dick out and now he has nothing in his brain telling him to stop. You have this woman who has been, as we all are, horny our whole lives,
Hmm.
and she's got nothing telling her to not be. And
Hmm.
I'm not a supermodel, but boy, the things that I have been told, uh, I had a woman just straight up grab me, just like, and she's like, this is good. And I'm like, this is not good. You need to sit down. Like, it's just, yeah. So,
Wow.
when I heard Elle McGibbons, I was like, yep, I've had that patient.
So now my question is Team Meadowlark fucking?
Oh my God, of
Oh, I
course they
mean,
are.
so since Viagra and like ED drugs have come into play, there's been like a something like 1,000% increase in STDs in nursing homes. Like it's rampant.
Mm-hmm.
So I guarantee you there's a bunch of them. I do believe, and you can cut this out if you want, but I do believe in a later book we get confirmation that Ellie has in fact boned somebody in the nursing home. I do believe that there's a reference to waking up after canasta night. So
I see. If anybody is
Who
going to get some
among
dick,
us has
yeah.
not woken up after
I mean that's what
canasta
happens at
night?
canasta. I don't know what canasta is, so that's all I can assume it is.
You've spent all this time around old people. If you have not figured out what canasta is by this point, then I think it's just a code word for
I'm in an
something.
inpatient setting, not like a home setting, so they don't play like social games there. They're getting treatment and they're
Oh,
going home. But yeah, I don't know what it is, but the
that's funny. That is funny. Yeah, I knew that like Ellie was a dirty bird, and I knew that that Jack certainly had his moment, but I didn't think about the fact that they could have some history together. So that is fascinating. There is one more person who is a named, I guess, sort of teammate for Team Meadowlark, and that is Agatha, who comes in with Team Meadowlark, but she is the homeless individual who caused the trash can fire that caused the whole nursing home to evacuate, which is the only reason these folks were outside in the middle of winter.
Totally a
And
wormhead. 100,000%. Gotta be.
you think she's a wormhead?
Mhm.
Absolutely.
Okay. All right.
I mean, they're literally
I
called infiltrators. Like,
I've read one book further in the series than you have. So I
uh,
cannot offer, I don't feel right offering commentary. Not that I even think we get an answer in the book that I read. Honestly, I don't remember. So when we get there, but yeah, I get the it's interesting that I thought, the staff members knew her. I mean, they knew who she was, and they even took responsibility for her. I think they said, she may be an asshole, but she's our asshole. And so I thought that was that like this person who is a nuisance essentially, but they kind of adopted her as their own, which I thought was not everybody is so benevolent when it comes to the unhoused population.
well, that's kind
Absolutely. I
of
mean, in a small
the
facility
humane
like what they're
thing.
describing, it's not that unusual. I mean, there's got to be somebody they would know the people who hang around, so it's not that
Hmm.
crazy. But I mean, she definitely is. So, you know.
Mm-hmm. Ellie, did you
But
have
also,
something?
that's just a humany thing that, like, when there's a catastrophe, when there's an emergency, we don't tend to actually turn on each other. We actually tend to
Hmm.
help each other more.
Hmm.
And at the absolute base level, like Vulcan logic, like, oh, look, another person, good. You can come with us and help us try to survive. You can do something, I'm sure. Even if it's just here, carry this.
One of the things that sticks out to me is like, why did Matt Dinneman write these characters, these old folks, into what is essentially like a murder crawl? You know, any thoughts about that?
I do. I have thoughts. Obviously, you see, they got the notes. I mean, yeah. I
That's a
no.
behind the scenes thing.
Yeah. Well, I'm here to break. I'm here to break the wall down. Um,
Breaking the fourth wall.
no.
We're out of walls, you guys.
I think it's probably, partly just because, Matt clearly has a very good sense of and a good soft spot for like vulnerable populations, systemic inequality, house systems, circumstances, that it tends to affect those people the most. And old folks are among the most vulnerable of our society. They, and they make for kind of the ideal underdogs. And, I guess we'll probably talk about it in a minute, but we can talk about it in a minute or now. But they are kind of the perfect moral dilemma characters. Like they
Hmm.
provide, I think there was a similar thing in The Walking Dead. Like it's a common survival, question that honestly people have realistically had to answer in
Hmm.
real life because it's difficult. Like, do you care for these old people who can't care for themselves? Even if caring for them expends resources, takes effort, and in this case, genuinely risks your life in a very immediate way.
Hmm.
Um, you know, like there are some of these patients who, if they were going to be valuable to your survival, it would be as a shield. Like I don't want to say that callously, but like they are, like as Brandon says, like they are people who they were just like on the floor. Like they
Or
described them like
XP
they're yeah. Well, I mean, and
leveling
that
up.
was those were the ones who, Imani had to kill. Like she had to use
Hmm.
her sword and kill because there was like the dungeon did its magic and fixed any infections or, underlying basic conditions they might have had, but it's not gonna it didn't make them more mobile. It didn't make them stronger. Um, they were going to die either way. And so Imani clearly volunteered to be the one who put them out of their misery. And that's the kind of I think that is a very compelling narrative. And I knew as soon as I saw them, I knew immediately like
Ugh.
this is what they're going to do. That's what they're going to have. That's the question they're going to have to ask, or at
Hmm.
least imply. I was as soon as I saw that was an old folks home, I'm like, this is the question they're going to be dealing with, and
Hmm.
that's why
Hmm.
I
Well,
think he put it in there because it's super
mhm.
compelling.
And it's also contrasted with Frank Hugh and Maggie Mai, who we also kind of
Yes.
see at the same time, because they would have ripped into these old people just to kill
Oh
them,
yeah.
Oh
either
yeah.
to,
Absolutely.
so I didn't think of that. Like, it didn't even occur to me that somebody would want to do that until Carl was messing with the spray paint like signs and things that they had painted to show other crawlers where they were. It never occurred to me that somebody would come across people, vulnerable or not, but think, I will murder these people to be of benefit to me. That just
I
Yeah.
think
is unbelievable to me.
Ellie brings it back to childhood trauma. Everybody drink. I think Carl has a decent grasp on like the banality of human evil and like what indifference can become as far as like harmful to other people, let alone outright malice or like panic or being in a
Hmm.
brain-breaking situation like this. So I don't think it's like super surprising that he thought of that because he knows what it is like to be
Yeah.
vulnerable and to not have power and like, oh look, a bunch of vulnerable people. I shall try to use my power to
Yeah.
help.
Mm-hmm.
Yeah. I do think Carl, um, due to his very prominent life trauma, has probably overestimates the proportion of people who would do that. I mean, we do kind of get glimpses, like we get a glimpse of like Hecla leaving her husband. Um, that there was clearly something going on there, like not just her being, a bad person, but like that she comes back and like finds her husband dead because she left him. There's lots of complicated stuff, but I one of the things that I do actually really appreciate about the Dungeon Crawler Carl books is that I do think Matt probably gets it about right in terms of the percentage of people who are like actually genuinely awful. I think most people are not going to be Frank Q and Maggie Mai. Just like it
Hmm.
takes a lot of life circumstance and just a lot of mess inside your head to be that kind of person.
Mm-hmm.
Well, they cite that as a reason why, like, it's unlikely that there's going to be a draft for a war again, because, like, it takes a lot of work to take random civilian
Hmm.
person and get them to a point where they can look at another person and pull a trigger on purpose to try and kill them. And like
There's a
the,
huge psychological and even biological imperative to just like not harm or kill other humans. It's
hmm
people can only really in general hit other people if they've been
hmm,
trained to do it or if they're in a survival situation. And that's just like
Or
with
trying to
your
save a
hands.
kid, because
Yeah.
Maggie Mai and Frank Q were motivated primarily by their daughter. Now, they also were law enforcement. So, who
Well,
knows if the daughter was the only thing that forced them to go in that direction. They weren't necessarily, who knows? Who
Yeah.
knows?
Yeah. No, I
Kid,
mean
I
it's
think, had a
definitely
lot to do with
more complicated than them being just straight up Hannibal Lecter, but like I
it.
think I do think that we definitely safely put them in the bad guy category.
Yeah,
Uh,
they're bad guys.
oh, I just remembered something. I just remembered something. Circling back to Jack's dick for a second. Uh, I remembered seeing a thing of I'm gonna get you to laugh on Mike one of these times. Uh, somebody was showing a picture of Alan Alda, and his ears are like half the size of his head, and his nose takes up most of his face. And somebody said that testosterone over time just keeps making your nose and your ears grow as well as like your scrotum. It's
Hmm.
like,
Yep.
is that why he
Well,
has such a weird old man dick? Is just because extra decades of testosterone?
foreskin too. So it's
Really?
so for testicles, your scrotum can grow, but it mostly stretches just because they're hanging and it's weight. It's just like breasts for women.
Gravity.
Over time,
Mm-hmm.
gravity takes its toll.
Mm-hmm.
But foreskin also stretches, and the everything can kind of shrink a little bit. So you can end up with somebody who has like a real high turtleneck going on.
That's
Just a
Mm.
yeah, way over their head, like turtleneck. It's
and the weird
you can
hat
you
thing.
Yeah, the
exactly.
weird hat thing.
Um, it is actually not uncommon for senior males to be circumcised, even in their like 60s and 70s, if that
Really?
becomes an
Oh, like
issue. Because
recircumcised.
well,
Like
sometimes,
circumcised
but
just late
usually
in
if they've
life.
been like late in life,
Oh,
because
okay, right.
because they will get like repeated UTIs if it like is closed around, because it's like so stretched and stuff. So that's the kind of thing you learn being a nurse.
Interesting. And I guess too, if
Huh.
somebody like if their body is shrinking in mass,
Hmm.
then it
Yep.
can just make it look more prominent.
Yeah, because a lot of the spongy tissue that forms the dick is like fatty in nature, and you lose fat as you age. So there's kind of a
Oh,
little bit of a shriveling effect. But apparently, as the mentioned in the previous STD statistics, it doesn't stop them. So
perseverance, which actually brings me, oddly enough, to my next question. Um, do we think that Meadowlark have, advantages or disadvantages compared to average crawlers? And, maybe some persistence and some problem solving with, deflated spongy dick. It counts as perseverance and problem solving that would aid them in the crawl.
yeah, I mean, obviously, we know Brandon and Chris are maintenance guys. They help Carl build the bomb chicken, which
Mm-hmm.
is a better name
It
for
is a
that.
better name.
It is better. Um,
Yeah,
Moab is
I
a
get what
thing.
Carl was
Like,
going for, but it's not good. Um,
they should have workshopped
uh,
it.
but Imani and Yolanda, they are both people who have, I mean, I'm sure if I talk too much about this, I'm gonna sound like I'm super full of myself and my profession. But being a nurse, you see, and a CNA, you see poop, you see blood, you see the literal insides of a guy who's getting split open by his cancer. You see all sorts of stuff that I literally won't say here because there's no amount of editing that will save you from this.
it's the editor. Thank you.
The only way you don't get that is if you become a nurse and work at some like, outpatient clinic that just does like physicals. And even then you're
Hmm.
going to see some stuff, but like it's that there's very few areas of nursing or teching that you're not going to see a lot. And working in an old folks home, you are going to see all sorts of stuff, have to deal with all sorts of situations. They're
Mm-hmm.
clearly, I mean, they have two guys working overnight to fix the oven. They are not a super well funded or stocked facility. So these are people who are used to improvising, used to coming up with what they can with what they've got. All of that is, those are all very useful survival skills. There's a knowledge of anatomy, how to keep people healthy, but also how to, you know, make
Oh,
people deliberately unhealthy.
Yeah.
Uh,
Oh, yeah.
see, my brain went straight to they're all old. So they've done stuff other than sit at a computer and type for the past 30 years like I have. Like
Right.
they
So
might know
like
how you're actually supposed to hold an axe to chop wood, or like, how to build
yeah,
a
so that was
shelter.
when I thought about like Team Meadowlark surviving, it's like up until they get to the third floor where they have race selection, like basically all of the seniors are out. Like there's no
Hmm.
it's very made very clear that even the ones who are like really with it, like a lot of them decide to stay back and let the floor collapse on them.
Oh
The
A
ones
yeah.
who are
rational
aware,
decision, quote,
Oh
right?
my I,
fuck yeah. We get left with the loonies.
that would have been the smart thing to do.
So those are the ones who clearly have can move and do stuff. Like so there are quite a few who may have had some of those skills. I don't remember how many they say actually survive, but I think it's actually like something like 20 or something like that
I think
total
so.
make it out. But they but before that it's just like they had to build a literal like train to get them
Hmm.
around. Like it's not the A team. It's and that's unfortunate, but that's just what it is. It's not even that one movie that I actually really love, Red. You guys see that one?
Oh, I saw
Retired and
Red.
extremely dangerous.
I
Yeah,
love that movie. And
I liked Red.
it's like none of that is going on. Obviously, it's Ellie in her chair hitting on Carl. Um
Hmm.
so I kind of didn't count them, but I think that once like we can see Ellie is clearly ready for the dungeon. Like once
She
she's a
fucking loves
fairy
it.
princess, yeah, she's ready. She's there. She's like, yeah, I'm gonna turn your genitals into a popsicle if you mess with Carl. Like you come for Carl and Donut, you come for me. Like, and then
Hmm.
she's like, and more, yeah, more booze. Like, and it's just she's ready.
Everclear. More ever. I'm gonna
Everclear.
take a fucking
Everclear,
shot of Everclear. Do you have any
rocket
idea?
fuel. Like that's
Oh,
Oh, I
oh
couldn't even
God, it's
walk
so
after that, much
disgusting.
less like, oh, let's go kill some shit. No,
No,
And she
I
still
can't
manages
drink
to protect Donut on the dance floor.
I can't drink Everclear like in juice. Like I can't.
Mm,
There's no. I
Tang.
can't do
mm-mm,
it.
The only
mm-mm.
Yeah.
thing that'll successfully cover up Everclear is Tang, because Everclear and Tang is the best drunk per dollar you can get. We were poor in college, but even
That's
then, like,
I want to give Ellie McGibbs some Malort and see how she does. I feel like she
no.
would be a Malort girl.
I'm
Hmm.
glad that was lost when Earth was destroyed because that was no that like
as
it's the
as
only thing I've tried that's worse than absinthe. That's
They could have fueled the bomb chicken with it in the dungeon for
oof.
sure.
but did you
Um,
but did you do the whole thing with the absinthe, with the spoon and the sugar cube and the water
I
and
did.
the
Yeah, that was fine. It wasn't the absinthe that made it fine. Um,
but I'm wondering, but do we think that once the race selection happened and they actually got physically capable of matching with the other crawlers, if there is some benefit from age that the former Meadowlark patients might have in the crawl?
So this is the part I actually like added this to the bottom of the notes. Again, more behind the scenes stuff because I like went on a rant about this. So this is the area that I think a lot of people to be clear, geriatric nursing is not actually my specialty, nor
Mm-hmm.
is it something I'm really interested in doing. It takes a special person to do it because it is so draining. It is the group of people who, on average, are going to need the most. They need constant supervision, constant care of all
Mhm.
kinds. And it's just not something I can do, like both with ADHD and just I also have kids. Like I do enough of the constant care at home. There's just it's like pediatrics and geriatrics are the ones that require just the most. And even a
Mhm.
lot of the
Mhm.
kids are like physically independent. So it's really a lot. And but I love my elderly patients. I have gotten so many stories about it from them, like just their life experience. So the one I wrote here, like that I think about all the time, I had an elderly black patient. She used to be a nurse manager in our area during segregation in the US. And she had to deal with patients and family members who would refuse life-saving care because it came from a black person. She had one who she was trying to give medicine to the family and they were like oh no, no N-word ain't given my, like and it was like antibiotics or something. And she was like,
Mhm.
I want to speak to the manager. So she did the thing where she went in the back of the office. She went in the back door, got changed into her manager outfit and then, met her. And she told me that. But the other thing she told me is that the dentists in the town I currently live in during like even after segregation would only like up until the 80s, I think, would only
Mm-hmm.
serve black people for 2 hours twice a day after business hours. Um, or twice weekly during after business hours. So there was 2 days a week where after business hours, black people could come and get their teeth taken care of, and they wouldn't care. So that if like a kid who had just gotten his new teeth in needed care, they just pull his tooth. So she was telling me about black kids in middle school, who were throwing balls of their dental adhesive putty at each other because they had
Oh
dentures.
God.
Oh.
Right.
Oh my God.
So that's the kind of thing that's like you can only learn from talking to somebody who lived through that. Like, unless you're reading very specific history books, that is not the kind of thing you learn about. And it's like really impactful information to learn.
Mm-hmm.
Like, that tells me a lot about the town that I live in right now and what it was like 30 years ago. Like,
Jesus.
yeah, it's crazy. And so I have so many of these patients who are so old, and like some of them have just had the craziest lives. And we all have stuff that like, we have knowledge that we've gained throughout our lives. And if we could do it over, we would have the tools to deal with stuff we didn't. So like these other people, like whoever these other Team Meadowlark elderly people are, have got to be the wackiest. Like they've just got to be out there. I would watch an entire miniseries about them. They've got to
We
be
need, yeah, we need stories about these folks for sure.
whatever crazy races they are now, the changes that they've gotten by the dungeon. Once they're in younger bodies, they're going to be the hardest mofos out there. Like, because you've
Mm-hmm.
seen Ellie, she's in it, right? She's like
Mm-hmm.
100 and she's ready. And then like I wrote like Vietnam vets, Korean War vets in the dungeon, World War II vets. Like Carl's got a skill of 8 in Frogger, right? This guy's got a skill of 8 in the last thing you hear before you die is laughter. Like this guy was stabbing people in the jungle in Vietnam, right? That dude then like also going home, living a full life, and then
Mm-hmm.
being an elderly guy who now gets turned into, I don't know, a tiger person like Batista or something. That
Mm-hmm.
guy's the scariest. That guy's gonna absolutely rip it up. And I would love that because it would just be all these like old people making like references to MASH, like and Bonanza the whole time, and just absolutely tearing the dungeon up. I would love that. So that's the thing that like really gets me is like there's I think once you get them to that point where they can kind of sustain themselves, I think some of the skills and stuff they have would be genuinely um like genuinely profound
Mm-hmm.
and valuable, interesting and helpful.
Mm-hmm. It sounds like you think that from your experience, Team Meadowlark, as far as like the patients and the staff and the just that all is represented fairly accurately from what you have seen. Is that, am I correct in thinking that?
Yeah, I do. I think it is. I think it's very and I don't think it's honestly super hard as long as as Matt Denman's really good at writing characters. And I think if you think about older people like people, it's not hard to get that right and get that true to life because they're just like everybody else. They've just lived a lot longer and they've had more stuff happen to them. And for the staff, I'd like to think that if the world ended and I was in their situation, I would take staff down. I don't know how I'd actually react in the moment, but not all of the staff would take patients down into the dungeon, but some people would very reasonably prioritize their own survival or those of their families or friends. I don't really judge anyone too harshly for that. That's a very difficult decision.
Mm,
But a lot of people do get into healthcare, not just because it's very stable employment, but because it's, you want to help people. And that's a
Mhm.
hard habit to break. And, I haven't had to do any evacuations. I've had to do evacuation drills, and I've had to do a lot of like moving patients around, for mostly like logistical reasons. And it's not easy, but, there's a lot of effort that goes into to patient care just normally. So, I don't think it would be that big a leap to be like, well, this is my job, this is what I do. Yeah, extreme stress. We also come together. We also focus on what we know and on the duties of our job, the positive reinforcement that comes from caring. Because I won't lie, it feels great when people thank me for being a nurse. Like I love that. That's part of it. So that's why I love Team Meadowlark so much. Like they kind of exemplify the best of what we want in
Hmm.
people taking care of our old folks.
Mm-hmm.
Yeah.
Mm-hmm. So, do you feel like if the dungeon starts here tomorrow, do you feel like the way that these old folks have reacted to the crawl is what you would expect to see real life,
A hundred
in real life?
100%. Yep,
Yeah.
absolutely. This is exactly like the story I thought of immediately was I had a elderly patient I was caring for. I was helping her like get from the bathroom back to her bed after we cleaned her up, and the fire alarm went off. And she said, "Oh, I'm sorry. I tried to tell my sons to keep the noise down when they're practicing their instruments, but you know how boys are." And it's like, this is the fire alarm. It's not a band. Like but that's not going to change. It doesn't matter what environment she is in. She doesn't know she's in the hospital. She's not going to know she's in the dungeon.
Mm-hmm.
They would be confused. They're out of their depth. They're going to be doing exactly what Ellie did, and that's going to be like, hey, can you put on divorce court? Like that's
Hmm.
exactly what they're going to be doing because that's
Mm-hmm.
how they live. Like you know, the ones that are aware, they make the decision to stay, as the floor collapses. And a lot of those that's where a lot of them end up. But the other ones, I mean, yeah, that's exactly how they would be. I
Mm-hmm.
think that's very accurate.
Yeah.
That
Do you
sounds kind of
think
fun, not gonna lie.
I just think of because I now work with people with disabilities,
Hmm.
teaching them to use public transportation. And a lot of our tradies, our clients are elderly.
Hmm.
And yeah, it is, it you're right. I think it would be very interesting to see these folks rejuvenated and in the dungeon for sure, because I think there's an appreciation. Because one of the things I hear, I don't know if this is your experience, all the time is, oh, I wish I had the body that I had when I was younger, or my eyes, or I
Hmm.
wish I had the eyes I had, or I wish I had the knowledge I have now with the
Yep.
body I had before. And like they sort of get that kind of, is the knowledge they have now with the physical capabilities or different physical capabilities.
Right.
So yeah, I wonder that would be yeah, that would be interesting. Some of them would be absolutely
Yeah.
unhinged. um, do you think is it worse to die in the dungeon or in a nursing home?
Um, I don't know that I can say either. I don't think I think it's sort of like six on one hand, half a dozen on the other. It kind of depends on how you die. I think if you're in the home in the collapse, you're gonna die immediately. If you're dying in a nursing home right now, like as people do pretty much every day, a lot of them are very comfortable. And a lot of them are not just because of the medical stuff going on or
Mm-hmm.
potentially neglect or any number of other things. Sometimes death is really peaceful, sometimes it's not. Um, just because of the age group you're working with and all the stuff that's going on. Um, I don't know. I honestly don't know if it'd be better to die in a nursing home. Then again, some of the stuff that happens in the dungeon is really rough, so who knows?
That's fucked up.
Yeah, it's really messed up.
I wonder, you know, if there is something to the fact that these folks, I mean, Ellie's what, almost 100,
Hmm.
she's seen people die,
Oh yeah.
so whereas it stops Carl in his tracks, I don't think that, not that they wouldn't be bothered by people they know dying, but it won't be the first time somebody that, they've cared about has died. And that in such a screwed up environment as the dungeon, I don't see how that could be anything but an advantage, like being able to compartmentalize and move on because it's happened to you dozens of times, not the first time.
Yeah, they're certainly more likely to have at least had people they know die, so they're certainly more like comfortable with it. But I think it's also worth remembering too, like as you get older, the like strength of your responses gets, weaker just because your body can't pump as much adrenaline. So like
Mm,
Hmm.
you get patients who will have a fight or flight response in some kind of, scare. But that turns into, he's like, what the hell are you doing in my room? Or like just kind of shaking. And so there's a lot of, I experience a lot more of the ones who seem to respond to affront with grouchiness. And so I would absolutely bet that one of them just walks up to a goblin just with a handbag being like, get out of here. Just like,
uh, I just thought of a thing of it was Amani who mercy killed the
mhm.
some of them, right? Like, do you think that's like a nod to her having to do that to the occasional patient who's just being strung along and just
Like in real
extending their
life.
misery? Like, just kind of nudge that medication a little bit higher than it was specified and let them peacefully
Um,
go in their sleep than 6 more months of
you'll have to
frailty
talk to
and
my
misery.
lawyer about that.
Not that you've done anything, but just
No,
if the
yeah.
idea exists.
Yeah, I mean, it's certainly something that I think, like I've had patients who are on their deathbed, and especially, most of the time when that happens, families, people around them, or even the patients themselves, if they have some kind of advance directive, which I recommend everybody get your paperwork in order, tell them what you want to do in advance. But provided all
Ooh,
that's
yeah.
set up, they get put on what's called comfort measures, and basically that means we can give them morphine every 5 minutes. Like we can give them a ton of drugs if we need to, because the goal is for them to be comfortable breathing as well as easily as they can, feeling as little pain as they can. And so we will use that. Like when I get that, the doctors don't do that lightly. They don't pick that just on somebody
Hmm.
who they want to be quiet. So I take that and I will give them, not every 5 minutes, but as often as they need, as long as the family is like, if they think the patient looks uncomfortable, I'm in there because that's like,
Hmm.
so,
It's all you can do,
I
kinda.
I will say that I mean, has a patient probably died slightly sooner because I gave them pain medicine? Maybe. But it's because they were already on the way out.
Hmm.
So maybe it's a nod to that, but it's certainly a nod to the fact that I would say that that's the more caring thing that she did. I think,
Hmm.
Hmm.
Oh,
as messed
100%.
up as it is, I mean, that's the decision that if I was one of those people that she had to kill, I would have hoped that somebody would have made that decision for me because
Hmm.
I would not want to weigh other people down if it wasn't going to, if there wasn't a chance that I would survive and do something better. Um,
Hmm.
I wouldn't want that. I gotta be honest, if I was Ellie, I don't know if I'd want them to do that to me.
Hmm.
I don't want other people to feel that they have to do that, but I also can't have any more respect for the people who would choose to do that. So,
Hmm.
Hmm. I mean, we're
Yeah.
both huge Pratchett fans, and he had the whole thing when he had the weird reverse Alzheimer's and was like,
mhm,
I'm not going to linger into nothingness. I'm going to jump before I'm pushed. And he even
mhm,
even he kind of stuck around, longer than he
mhm.
was meaning to.
Yeah,
And we don't actually know how he died. Uh,
yeah.
Hmm.
Well, I don't really want to know because he went out
nah,
like I would assume he went out like he wanted to.
Hmm.
yeah.
I sure hope so. I sure hope so. Yeah, it's interesting that these characters, there's so many like big themes in the book that I think
Hmm.
these characters kind of exemplify. Like one of the things that I think comes up a lot is like morality is a privilege and
Hmm.
empathy comes at a price. And I think
Hmm.
even with what
Hmm.
we've discussed so far, these characters, I mean, just demonstrate that from the second we meet them, because there's
Hmm.
real consequences to doing what Carl thinks is the right thing and Mordecai thinks is crazy as fuck. And a lot of
Yeah.
viewers apparently think is crazy as fuck too.
Yeah.
So you see a lot of those big those big themes in just this little crew.
Say it with me now. Go fuck yourself, Zev. Um, yeah. I think that's absolutely true. Like it is absolutely a privilege. I can't help but think about the tragedy in Gaza. There was a story I read where a young mother, father, and their son survived because the grandparents, like there was an explosion and the grandparents were in the way of the explosion, like in between where the part of the house that exploded was and them. But the grandfather was still alive. And
Oh,
the house was like collapsed, like part of the wall was collapsing on them. And with the last of his strength, he kept the wall from collapsing on them, like held it up,
oh.
and they crawled out. They got out, and he saved that entire generation of his family and the next generation of his family. Um, like he did that because that was a survival situation. And they, the interview was heartbreaking because they were saying like, why it was my father. Why did I not hesitate to leave? Why did I leave when he told me? Why didn't I try to save him?
God.
And it's like he feels so guilty for surviving. And it's like, that's so horrible. But of course, that's the right decision. I don't know what kind of person could look at that and be like, that was the wrong thing to do. Of course, you get you and your wife and your son out there.
And I'm sure
Like,
the dad, I'm sure he was
yeah,
doing exactly what his dad wanted because
of course.
parents, well, your instinct is to lay down your life for your kids.
Yeah, I
And
mean,
what
that
he
is
would want his kids to
legit
do, right?
hero.
Like,
100%. That's what he would do for his child too. And like he's clearly, but it's also his dad. And he
yeah,
like
no.
ran. And it's like, so that kind of, those are the kinds of, decisions you have to make when you're in this like the least privileged situation possible. You are literally being shot at, you're in the dungeon, you are there. You have to make the decision to euthanize your patients. Like you have to
Mm-hmm.
do that because that's the equation you have to run through your head because if you're going to survive, I mean, you can't bring them with you because all they're gonna
Mm-hmm.
they and if you don't kill them, they're just gonna sit and suffer.
The
Mm-hmm.
terrible algebra of survival.
Yeah,
Or you have to be willing
Practically called it.
to.
that was another good 90s band.
God damn it, Chad.
Yeah. I think
Stealing my bit.
I think it's Katya and Donut at one point who say, "You're gonna get us killed anyway. We might as well be killed doing something
Mhm.
worthwhile."
Exactly.
So there's some thought of look, acceptance of, yeah, this may get us killed. This is clearly the worst decision strategically, but we're gonna do it anyway because
Hmm.
if we get killed doing this thing, that's still better.
Yeah.
We would still rather do that. So, and that brings, we haven't actually talked about for the main characters of the series. We barely talked about Carl and Donut,
Yeah.
who we love. We certainly don't want to discount them. How do we think that this interaction with Team Meadowlark kind of informs their journey or will affect Carl and Donut moving forward? And is there a difference between how it's going to affect either one of them?
I think Carl he is the ideal man in my view. He is a guy who is struggling, but he also doesn't whine about it. He doesn't, he does make a decision. He's just like, well, I gotta do what I gotta do. And he eventually, a lot of times, uses his kind of emotion and instinct to make that decision. And in this case, like Donut is like, I know what you're gonna do before you even know.
Mhm.
And it's he's reeling from this like the loss of his entire world, which he already wasn't super attached to, if we're being totally honest. Like he wasn't the most,
It wouldn't go great.
He's a little disengaged.
yeah, he was a little disengaged from everything, understandably so. And but he's still reeling from that. He's just met two murderers who tried to do the murder on him. Like he's just met the basically his worst case scenario that he's been wary of his this entire time just came true. And and other humans tried to kill him. He's had to kill a lady with cockroaches coming out of her mouth. Like it's just
Ugh.
awful.
Oh,
And he's trying to figure out what the right thing. Yeah, that one was bad.
that is the
That one
That's
got
worst.
so
me.
rugged.
I barely got through
Ugh.
that. Like that's where I bailed the first time I started reading the series and couldn't get into it. Like I bailed there. And I still think with everything we see, that is the roughest bit.
I think there's a reason for that
Oh,
because that got me. That was like one of the three of parts of that book that I was like, oh, I'm in. I'm in this. This is gross as hell, and I'm so ready. Because I mean, frankly, I've seen bugs on wounds before. I've seen it. I've had to take care of patients where stuff crawled out of them. Like that
No,
happened. Yeah.
no.
So like that didn't bother me at all. I'm not like anyone who'd seen the things that I have had would not. I'm not like special because it doesn't bother me. But like I was reading that and I was like, yes, get them.
Yeah. I
Um,
recently learned you can actually vomit shit. This
oh
is
yes,
something that I
absolutely.
learned.
Yeah. It's
Oh, yeah,
super
of course.
common. It happens all the
What?
time.
What? See, I read it and I thought, oh my God, this is like one in a trillion things that
No,
happens to almost
no.
no one, but it is technically possible. But you're saying it's common?
Yeah, I mean it's not what like most people come in, but anyone who has severe enough constipation for long enough, their system will get backed up that it just comes out the top. Your body's got to get rid of it somehow. That's the way it happens. Yep. I mean it's real straightforward plumbing. It really is.
Oh,
It's a
that makes
plumbing
so much
issue.
sense. That's so
Yeah.
unpleasant.
Anyway, it smells as bad as you think.
Oh God.
What
Oh.
you're thinking right now is about right. Um yeah, no, he's so Carl's reeling from all of that. Like he's just like what is going on? My cat can talk. Why is this cat also my best friend now? Um I've got a drunk master splinter
Why is he
teaching me
so
the
grumpy?
ropes. Why is
Mm-hmm.
he so grumpy? Um, what's going on? And Donut just bumps him on the head and is like, we're gonna help these people. And like you can really see kind of a moral clarity from that point on. Like Carl is
Mm-hmm.
not as lost after Team Meadowlark. Like whether or not he's totally altruistic, because he does think like he does seriously weigh the decision to like
Mm-hmm.
leave them.
Well, you gotta
But like
like.
he decides to because like the like he says the moment we stop helping each other is the moment that we stop being human.
Mm-hmm.
Um
Not to mention, I do feel like he's got a little pathological demand avoidance. So Mordecai, by saying you can't, get it through your thick skull, you can't save them all. Part of Carl's altruism is a little bit of like "fuck you" altruism. Like,
Mm-hmm.
I think it's less pathological demand avoidance. I think it's that sense of justice and it's a little bit of
mm,
spite. I think he's
mm-hmm,
Mm-hmm.
got that like he's like this is unfair. Oh, and you say,
Six
well, that's just the
one.
way the world is, kid. Well, fuck you. That's not how my world is. Like it's kind
mm-hmm,
of his. I think it's a lot of that because he's definitely okay getting like demands placed on him. He's just
Mm-hmm.
mm-hmm.
he doesn't he if not if they're BS. Um,
The world is unfair. Well, what are we gonna fucking do to change that? Let's go.
yeah, not
Yeah.
after I kick its ass. It's not. Um,
What else do you want to mention in regards specifically to Team Meadowlark that we haven't mentioned or that I missed?
I don't think there's honestly, I don't think we really miss anything. I mean,
Okay. Good.
I've kind of already said most of it. These are people who are like super driven at a very
Mm-hmm.
difficult job that gives
Mm-hmm.
them the ability to survive in the dungeon, I would say at above average rates. I mean, really, it was just the residents who were the euthanized, the ones who chose to stay, and Yolanda. And everyone else made it, basically. Well, except for Jack,
Mm-hmm.
but we don't count him. Um, and
He did that
like everyone else
himself.
made it, which is really impressive considering what they were dragging along with them.
Mm-hmm.
And they're dedicated people. They're very interesting moral, they have a lot of moral complexity there. There's a moral an ethical dilemma and like leaving or staying, but it's very clear that like you see them and you're like, oh, they made the right call. Yeah, like of course they did. Like everyone kind of I think instinctively reads that, and even if you're like, yeah, maybe the right choice was to stay, you're like, but Carl and Donut did it, so it's right. You
Mm-hmm.
know, and that to me is like, all the stuff about um, them how they would survive medically, how they would do all of that. Um, yeah, it's secondary to me because it's just like that's a real hero story. There's a reason that it really grounds Carl. I think it really cements him as a hero, as like the guy is
Mm-hmm.
because he was like he saved these guys when he did not have to.
I mean, the book opens with him literally saving the cat, which is, writer
Yeah.
shorthand for this is a good guy. And then we're like, actually, you know what? We're gonna triple down on that.
Hmm.
This guy is a really good guy. and a bench,
Yeah.
and
Mm-hmm.
even he's a little worried about it.
Mm-hmm. He's
But you
also
can be
kind
on
of a
this
dick,
guy's side.
though, which I like.
Yeah.
I
He's
mean,
not
Hoopst among us.
Yeah, well, he didn't have to be perfect. It doesn't make him not a
just
dang
good.
hero.
Yeah. Yeah. He's
Yeah,
fucked up enough to be interesting. But is
there it is.
yeah. Mm-hmm.
Okay, we
Mm-hmm.
can do this really quick. I want to do how many Carls.
Okay.
Can we do that?
All
So we
right,
can
we
do
can
it
do that.
for I want to know, or I can explain the rules and then people can wait for it the next time I'm on. So I
Okay.
did a thing while I was researching this where I was like, there's this old um the series of YouTube videos where someone goes through the whole Home Alone franchise and says how many of the bandits, how many of the criminals would they need to get through the Home Alone franchise? How many lives would they need? Because it turns out that kid is just killing them with like paint can traps and stuff. He's just knocking them
Young
out.
Jigsaw.
Right, exactly. How many lives are they going to need, right? So I've been looking at the times, like noting the times that Carl definitely should have died if he didn't have the dungeon magic shenanigans. And so I was like, we're gonna play a game called How Many Carls.
Okay.
The rules are you get one full Carl for every time he would like 100% dies without dungeon enhancement or healing. One half Carl for any time he would have died without dungeon shenanigans, but may have lived with intensive modern medical intervention, or a half Carl for any time he might have survived but would have been like crippled or permanently incapacitated without dungeon shenanigans. All
Okay.
right. And the last rule is whatever it is actually has to actually injure him. So that like troglodyte poison doesn't count. It's negated by the cloak. So it doesn't count. The
Okay.
poison would have killed him, but it doesn't actually happen. So,
What
if
about
anyone's
the
listening and wants to follow along, you can try and guess how many Carls you need to survive book one, because I have found it. I'm right. I know.
what about
All
like the
right.
boiler breach and he's behind the magic door?
It doesn't
Like,
count.
but
Doesn't
without
actually
the
hurt him.
So
the magic, I mean, it smacked into him. Like,
Yeah,
so
but
he has to take damage.
right. He has to take the damage. It's like
gotcha.
about because otherwise we can argue about well the blast wave would have blah, 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 and it's like no, that's not. We're not doing that. So it's like it's of the injuries he
Just
actually
checking.
takes where he has to
Okay.
take a healing potion, his foot snaps back into place or whatever. How
Duh.
many of those would he have survived, like without it? So I
Okay.
know the answer, and your listeners can await
All right.
eagerly.
Well, we don't have a discussion question this episode, so maybe that'll be our discussion question for next episode. So people can leave it in a YouTube comment or they can email us and let us know how many Carls. So we're going to discuss books 1 through 3, but how many Carls we're just playing for book one. What do we want to make that our listener challenge? Just book one or books 1 through 3?
Just book one, keep
Um,
it simple, get the
yes, do
rules
book one for
established.
now. Yeah, let's do book
Okay.
one for now. See
All
how people
right.
do.
That sounds good. So that'll be
Guessing off
our.
the hip, I'm gonna go with 6.
Oh boy. I don't know if I have a guess right now. I would say I gotta remember the early like goblin. Like you gotta remember the whole thing is what I'm wondering if there are little like hits and things that happen. And he came in with like an infection. Remember?
Hmm. Hmm.
Are we counting that? Like he came in. Well, no, because Donut bit him in the dungeon.
Hmm.
No,
Because
it was from
he
getting
walked
scratched
into
up
the
when he
dungeon.
brought
Yeah,
her
he
in.
walked into the dungeon and he got cured of some stuff.
Yep.
But
It's a
then he took.
frostbite. He had an
Yep.
infection from where she scratched him.
But then there's also like he
Um,
when he took that first example healing potion from Mordecai. I feel like it.
See, you're into the game now. I got you. See? See? I got
God
you.
damn it, Chad!
I knew. I told you once you start doing it, you're gonna be like, well, would he have survived that without it? Like, yeah, you just gotta think about it. So yeah, I got you now.
You got a goddamn it all
Good.
yourself.
We needed more work for these books.
All right. Well, on that note, Miss Ellie, do you want to close us out?
Thank you for joining us for this very special episode of New Achievement. Next week, we'll be back on our regular scheduled crawl with, you know what? I'm going to call it the first 12 chapters of Book 4, Gate of the Feral Gods. An extra thank you to our friend Chad for offering his expertise, opinions, and perspective on our wonderful team at Meadowlark. So until next time, Be sure to get out there and kill, kill, kill.